Now, in line with your period, Giovanni, I think the issue related to key risk factors in periimplantitis, what areas will you focus on?
I will predominantly focus on patient-related and implant-related risk factors, modifying factors that are documented in the literature for the peri-implant mucositis and periimplantitis regions.
Is there anything new in that field when it comes to the background of the patient?
Well, I think the understanding that we have today between periodontitis and periimplantitis is at the etiological level, it's and at the clinical level, it's quite clear, but there are differences in the histopathogenesis that make those two diseases not fully comparable.
Is there anything in the outline of treatment procedures for clinicians to consider when it comes to risks for periimplantitis?
Based on the evidence that we have, I would say yes, we should consider periimplantitis to be an aggressive disease, more aggressive than the chronic periodontitis disease, which will make a early diagnosis of the disease process very important, and also the therapeutic protocol.
Would you have anything to say about type of implants? Anything there that will give attention in your period?
I think based on the current evidence, it's premature to say that one surface compared to another is more exposed to a risk to develop the disease. This, I think, should be carried on in large clinical studies before we can come to solid conclusions.
Well, perhaps we can add some aspects in line with that issue in some new exciting material, the results of which will be present during the springtime 2015 and be able to present at the meeting of Europerio. And also in line what you mentioned, Giovanni, with comparisons between periodontitis and periimplantitis, I think we have some very new material on human basis, where we are assessing the differences between periimplantitis and periodontitis.
I heard about that at a congress, and I would be very excited, and this would be also one of my motivations to come to Europerio to London to hear about this new data on human biopsies. Could you maybe expand a little bit more on that topic?
Absolutely. I think what we understand today is that periimplantitis is a much more aggressive disease. You know, it is not only larger than periodontitis, it has a different setup in the composition, with much more presence of neutrophil granulocytes. Also, when you look at the lesion, it is not walled off from the biofilm in the pocket by a pocket epithelium. This means that there is a war going on between the bacteria in the pocket and the host response in the lesion. So this is a challenge to clinicians, and we need to learn more.
Do you think also that we will learn more about maybe a different composition in the microbial etiology of this disease compared to periodontitis?
I think we need to understand this issue much further than we currently do, because that will also have an influence on the selection of treatment procedures, Giovanni.
So this will maybe also address the issue in the clinical treatment of periimplantitis with respect to the use of antibiotics?
Indeed. That question is addressed in a very recent study on a randomized controlled clinical trial that we will be able to present results from in the Europerio.